Ready?
Yes.
All right, welcome. It's Monday, February 10th at 6:05 to the Safety and Health Committee. To my right is Todd Sievert, to my left Jeffrey Whidden, and myself as chair, William Twist. And we're here tonight to provide a recommendation to council regarding the authorization for the Director of Public Safety to execute two documents related to providing emergency 911 responses to the Upper Valley Medical Center campus. Those two documents would include an agreement to accept a $175K grant from the UVMC Community Benefits Fund to offset the purchase of an ambulance, van, and an agreement for payment for emergency response services by UVMC. And this is considered an emergency legislation. So, would you like to start for us?
Sure. Thank you, Mr. Chair. So prior to 2017, UVMC, the campus, was part of the Troy Fire District under the within the same boundaries as Concord, the rest of Concord Township. There was a shift in service responsibilities. That was an issue that was ironed out between Concord Township and UVMC. So since 2017, UVMC has employed a number of private ambulance services to provide both inter-campus patient transport as well as 911 emergency response. We've been working with UVMC and representatives of Premier for the past several months to discuss how we could begin to provide primary emergency response only, not the inpatient transfers for appointments and the like. We've been, since 2017 or thereabouts, maybe a little after that, been on a backup contract, kind of a mutual aid, but it's not called mutual aid since we're dealing with private ambulances, but with UVMC in the event that there were some response concerns based on the call and the timing and other factors. So we've been doing that on a backup basis, and this contract would restore us doing primary emergency response, primarily out of Station 12. This would, again, as I mentioned under the contract, that the draft contract language, we would only provide emergency response, no on-campus patient transport. Call volume, I will say, is not a concern, actually, given the estimated calls that we would make to UVMC campus. It's a lower expected call volume than what we had back in 2017 before and before then. As I mentioned, Troy Fire District or Department has provided backup service, but response issues with the private ambulance allowed the two of us to get together. I will say that there's two pieces, as the chair had mentioned. There's two pieces of authorization that we're requesting from council. One is to authorization to sign a contract for services for a period of 5 years, and then we would evaluate that. We would be paid a primary rate of $1,519 per run. I believe there's an escalator clause, inflationary. Don't quote me on that. That would be an increase from the backup contract amount that we had. The other piece of legislation is to accept a donation of an ambulance from the UVMC Foundation. The UVMC board did authorize, and I believe it was in your packet, the letter granting us $175,000 towards the purchase of that ambulance. which will cover the cost of the ambulance, as well as outfitting it with initial equipment needed on the ambulance. As the chair mentioned, we are requesting emergency legislation. We had hoped to be in a position to have something started at the beginning of January, since, as I said, we have been discussing with UVMC since mid last year, and the hope is to get this service reinstituted as quickly as possible. There may be a little delay in getting the ambulance, nowhere near the other delays that we've experienced and are actually still experiencing, waiting for that second ambulance to come in. That is a different style, a different model, a different size ambulance, and so this one will not be as impacted as that one. But in the meantime, we would pick up that service with our current fleet.
Any questions?
No questions. I think it's a good private, well, I may have one question that just occurred to me, but no, I think it's a good private public partnership. It's something we should do. But as you were talking, this is only emergent transports. So are you, I mean, is it primarily just taking people from Kester to the ER?
No, it's no.
Where are you?
It's not emergency transport. It could be transport. It's any emergency call. It's an emergency response. So there may be a transport, there may not be a transport. There may be an emergency transport from Kester to the ER. The two assistant fire chiefs are here in the audience, and I neglected to mention that we do have a representative from UVMC that, Mr. Chair, you may want to recognize and allow to speak, if I may be so bold.
Sure.
But to your question, Wade and Don are in the audience if you want to dive into that a little bit more.
I was just trying to figure out what the process or the purpose would generally be, but no, I think it's a good thing to do, and if they want to approach and explain it in more detail, that's fine, but I'm not opposed to it. It just occurred to me when you were saying it's emergency only that there's an emergency hospital on campus, and so I was trying to figure out what we were doing.
Well, I'm emphasizing emergency because there is the transports that occur between buildings for patient transport for appointments and the like, non-emergency situations. And we do have a sensitivity that we don't want our staff to be at the risk of advertising for one versus the other, an Uber or Lyft or a taxi cab service. I'll use all three. And so that is part of the contract. I mean, UVMC will continue to provide private ambulance transport, non-emergency transport on campus. So that's the reason I made sure I said emergency.
Do you have any comments or questions?
Mr. Sievert mainly hit my own point to try to explain to the general public why hospitals need ambulatory care for what they do there. I do have a question for either one of the fire chiefs in the audience, if they could come forward.
Just Wade. You drew the short
straw. You can
I did the short straw. So, Wade Dexter, Assistant Chief.
So the question is on the Sprinter van and what services, because I know this, I've talked to Mr. Tittering, this van would also be able to go on its normal calls that you guys receive. This in the city of Troy, the services it could provide versus the full-fledged big boys we have that would go out.
So the additional ambulance would be stocked with the same equipment that our current ambulances are. The intended use for that new ambulance is to take some of the lower priority calls. All of our calls come from Miami County Dispatch in a priority 1 through 5. Priority 1 being not breathing, priority 5 being my back hurts or I hurt my foot. So the intention would be to use that smaller ambulance for those lower priority calls when resources aren't as needed. And then that ambulance would also be used to provide these 911 services out at the Upper Valley campus.
Okay. And we won't have any staffing issues to staff up that new ambulance, or will we bring on additional staff for that?
So we are discussing with the union how we can broaden the service community-wide or district-wide. But in the meantime, what this contract would provide and why we want to get this going is so that we can add UVMC to our service levels immediately.
Okay. Thank you.
Can I ask a question?
Yes.
Where's the ambulance going to be stationed?
So we haven't made all the operational decisions for it yet. Originally, the conversations were placing it out at Station 13 because we have extra people out there that would give us some more flexibility, but we're still looking into that. So
Is 13 the one by Myers?
Stanfield, yes.
Yeah, Stanfield.
There's also been discussion about 12.
And we feel that estimated it's going to be 50 to 75 calls a year.
That's correct.
And currently, as backups, how many have we handled?
Don?
60?
For the last one.
Okay.
So basically, we're changing.
So basically, we're doing
we're
it now
changing the
just
paying
as.
source.
We're getting an ambulance, so good job.
Okay. So we've done 60. Okay.
And
All right.
prior to the big changes back 2016, 2015, we were pushing over 200 calls out to that campus a year. So.
Wow. Okay.
And again, we do have a representative
Yeah.
from UVMC.
Hold on, Wade. Any other questions from council members before you leave? Because I know they're going to be there before I call.
I don't have a question for the Assistant Chief. Mine goes back to Patrick for the language that the letter that we got that was attached to our staff report from UVMC and staff. I just wanted to make sure that the outfitting or the language describing everything that rig will have outfitted is agreed upon, because there seemed to be, in my opinion, a little disparity between UVMC's language in their letter versus the expectation of what I'm seeing in the staff report of a fully outsourced rig or equipped rig. So I just wanted to make sure that
We,
was,
one way or the other, we are going to make sure that that is outfitted as the same as any of our other ambulances.
okay. And that is encompassed by that $175,000
Yes.
figure.
We believe so.
Got it. Thank you. That's all I had.
Ms. Marshall?
So, okay, so you said, just give me an example of like a call that somebody would get from out there.
Okay, so it would be covering not just Kester Pavilion, the dialysis center, the hospice center, the mental health unit, and on occasions we've actually gone to the physician's wings. But those types of calls that come in are for a sudden onset chest pain, stroke-like symptoms, heaven forbid cardiac arrest. These are the more severe in nature. When they get bad lab values, they've had blood work drawn, that kind of stuff, and need to be evaluated, that's when Upper Valley's transport services take care of those type calls.
And so, okay, I want to make sure that I'm clear on this. This is not strictly for UVMC's campus. It can be used, will be used anywhere in the city.
That's correct. This
Right.
additional ambulance will be used
Okay.
anywhere in the city.
And everything that is on that van is exactly what would be on another ambulance.
They will be equipped to the same capabilities, yes.
Okay.
Any other questions?
No.
Okay. All right. Thanks, Wade.
Thank you.
If
Thank
UVMC, if you would like to come forward to state your name, if you have any other comments to add, we'd like to hear from you.
Thank you. I'm Diane Runekamp. I'm the Director of Finance for Upper Valley and Premier Health. And I just want to commend the group for our continued relationship, and we look forward to continuing this in a contractual manner. As was stated, our utilization of your services is pretty much going to be unchanged. And so through I do want to correct, because it is a very important piece, that the donation of the Sprinter van will be coming from the UVMC Community Benefits Fund, not the UVMC Foundation, which are two different organizations, aspects. So that's where the Sprinter van is coming from. So we just appreciate the ongoing relationship.
Thank you for being here. Any questions for Nope, okay, thank you. Any other questions from other council members in the audience? Mayor Oda, I see you waving your hand back there, doing a jumping jack. Just do some cartwheels down this aisle and we'll be...
I just think it's very important that with these discussions that we've had with Upper Valley, it's important for you guys to know they have to call 911. That they
Right.
can't just take people to the hospital. There has to be a 911 call, and that's kind of the reason for, they can't just use one of their vehicles to take people. And I feel like that's kind of missing from the
Yep.
conversation, that
Thank
they
you.
have to call 911, even though it's on the same campus. It feels very duplicative, but that's kind of the process behind it.
Yeah, thank you. Any comments from members in the audience? All right, how would you do?
Move forward with emergency.
Move forward with emergency.
I would agree, so if we can prepare, move forward with emergency to council. Anything else to come before the safety and health?
No, sir.
All right, we are adjourned.